I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome, everyone. Today, we are going to be talking through some of the testimony that happened this past week in the Tanner Warner sentencing phase. The state, I think, did a phenomenal job presenting the evidence is there for just how tragic and horrific this crime was and why the state believes that the DP is the appropriate punishment. The defense is submitting mitigating evidence. And I was glad that with the evidence that came forward, specifically related to his diagnosis of autism, nobody is saying that that diagnosis explains what he did or that that diagnosis had anything to do with, if we're talking about, did he willfully do an act or was there something else? My personal thoughts, not having met him, just based on my years of experience working with individuals on the autism spectrum, his issues went beyond what I would consider to be like the symptoms of autism spectrum disorder. And that's where I would wonder if there were more conduct disorder and if there was more, because the state mentioned oppositional defiant disorder, and y'all know I don't like that diagnosis, but what goes beyond that is oppositional defiant disorder, conduct disorder. And then beyond that might be antisocial personality disorder. And the state did ask specific witnesses about that. The testimony from this past week, so it was emotional testimony from family members, and we are going through some of that. There are content warnings for, and I'm not going to go into specifics, but you can tell that multiple family members have a history of their own trauma. And the expert testimony, so they haven't, to my knowledge, they haven't had anyone on the stand that did a clinical evaluation of him. They did talk about his brain scans, and we will get to that. They did have somebody talking about lead exposure. We will talk about that. But they haven't had anybody that's done cognitive and personality testing with him yet. And I do believe that the state is likely prepared with their own rebuttal witnesses for why they don't feel that his autism spectrum disorder diagnosis, that any of those things that the jury should consider that as mitigating evidence. I think the state believes that he should really have the biggest consequence possible in the state of Texas. And they talked about him eating coins as a child, and what would be more common is that a person, if somebody was eating paint. So if he was in an apartment that had lead paint and eating paint chips, but there are minimal amounts of lead in coins. We will talk about the coin issue a little bit later, and we will get to all of that and a little bit later. And so this question from Northwest says, I was disturbed by the questioning of mom and mom's childhood. What was the point? And I think they're trying to humanize him because I think the defense was going to get in to her substance abuse. Also, her she worked as a stripper and as a worker, an adult worker. And so I think that was part of the reason why they went into some of her history as well. And there were times that she specifically asked and the defense moved on. There was a particular question that she didn't want to ask and the defense moved on. All right, so let me pull up my notes, and I want to start with the personality disorder and assessment psychologist. So the psychological testimony, it's been really interesting to me, but it has been like, because really because these people did not evaluate him, they are just giving general opinions. So I don't know how much weight the jury is going to give any of that testimony. But there was a particular doctor, he actually wrote, so I give the personality assessment inventory. I do not evaluate, so I don't do forensic assessments, but he developed a scale specifically for forensic populations. So the personality assessment inventory, clinicians that give it, there are these reports that can be generated, and he created a report for forensic populations. So not MMPI, the personality assessment inventory. So that is the PAI. That was the one that Dr. Curry gave Amber Heard. I think she might have also given her the MMPI, but I personally like the personality assessment inventory. It's written at a lower reading level than the MMPI. And on the MMPI, it's all true or false. Like your only options are true and false. Whereas on the PAI, you have false, sometimes true, mostly true, very true. You have more options. And so for the populations I work with, that tends to be a better thing. So in graduate school, I had to take the PA or the MMPI, and because we would give testing to one another and to practice generating reports and to practice all of those things. I hated taking the MMPI. So I've taken multiple personality tests. I've also done the non-clinical tests. So there are some tests that, because the MMPI and PAI, they are clinical. They're getting at clinical levels of depression, anxiety, personality function, those things. And then there are like strength-based leadership tests that are, what was it? There's some pretty popular ones. My brain is, but there are certain things they'll get at leadership style or different personality assessments. Yes. All right. MPI is it's exhausting and it's longer. So the PAI is shorter. I think the MMPI is over 500 questions. It's really, really long. So I personally do not give that one in my clinical practice. I use different tests. So he was called by the defense. He has a history in doing assessments and then also doing research on incarcerated populations. And he's often called as a part of the appellate process, or because I think it was only his second or third time testifying in court about his general opinion. He did not meet with Tanner, and so he didn't have an opinion about him specifically, but in general, talking about, because sometimes they're recommending the death penalty because like a potential risk to the community, or every state, every person has a different reason for going for that penalty. I think in Tanner's situation, I think it's the heinousness of his crime. I think that is why the state is prosecuting him to the fullest extent of the law. And he's in Texas. And multiple people have put it in my comments, don't mess with Texas. And we'll see. We'll see what this jury decides. But he talked about, he studied the DSM-5 personality disorders, and he explained what personality disorders are. That a personality disorder is a long-standing pattern that develops normally in like late adolescence, that where this pattern starts to emerge and then continues into adulthood. And I was glad that he mentioned we do not diagnose children with personality disorders. So if I'm working with a teen that has some features of a personality disorder, I will mention features and that the importance of clinical intervention so that this doesn't become an ingrained pattern. But really, personality in adolescence is still forming, and that's why you should not diagnose personality disorders in adolescence. And also, as a teenager, because let's say I'm working with an adoptee that is struggling in their adoptive placement and they're having all of these behaviors, all of these attachment and all of these issues going on, if we provide intervention and then all and that the client that I'm working with, if I'm working with the teenager, they don't have control over their environment. So I've worked with people that they had a lot of signs and symptoms of things like borderline personality disorder or even histrionic personality disorder. They exhibited these signs and symptoms in adolescence, but once they were an adult and they were able to have a safe environment, they didn't have to attend school. So school can be its whole other microcosm that can trigger a lot of trauma with people. And so I've had a lot of people not have those same signs and symptoms that they had in adolescence once they get into adulthood. And then there have been other people that have. So I've worked with them in adolescence and now they're an adult and they're still having these significant issues despite intervention. And then that's when sometimes, so I, as a outpatient therapist, if this is my therapy client, I do not diagnose a personality disorder. I would refer them for a psychological evaluation because once somebody gets a personality disorder diagnosis, it's really hard to get it off of their chart. And then also that diagnosis can limit their ability to get life insurance. So sometimes individuals that are diagnosed with borderline personality disorder, they can struggle with getting life insurance. They might be charged more for life insurance. Just because some of the features of that diagnosis can be things like attempts to oneself and different things like that. And so some diagnoses truly do carry pretty big stigma. And so there's some things that I just don't diagnose. If it's my therapy client, I would refer them out for a psychological evaluation. As a therapist, and as somebody that does psychological assessment, I don't assess somebody that is my client. So if they're my therapy client, I'm going into that assessment with a bias. I already know them. They've already opened up about a bunch of things. I might already have a general idea of what I think might be going on. And so referring for a neutral assessment, you can often get a better understanding. This expert did talk about the fact that the reason the DSM keeps updating is so that when if one person is seen by two or three different people, they get the same diagnosis. So a person with the same set of symptoms, if they go to one person, they might get one diagnosis. If they go to another person, and so they continue to update the DSM so that it can be a I don't know, just so that diagnosis can be more consistent. That's what he said up on the stand. He talked about developmental disorder versus personality and how developmental diagnoses start in childhood and those symptoms are different from personality disorders. And he did mention that with antisocial personality disorder, that with that diagnosis, some people can yeah, so he just kind of I got lost with some of it. Like he was really smart. He provided really good information, but sometimes I would get bored and I would have trouble paying attention. So I would take notes when it was helpful, and then I would kind of come back to things later. So he talked research on antisocial personality disorder, and he mentioned that just because somebody has that diagnosis does not mean that they are going to be aggressive in a prison setting. That in prison populations, about 75 to 80% of the prison population could qualify for antisocial personality disorder, but the rates of actual rule violations and harm in prison is low. That was based on what he was saying. He also talked about that the risk factors for somebody being aggressive in prison, and he said younger, so being under the age 21 years old and younger, lower academics, and he said the test and that they use in Texas is the TABE, and I googled it because he didn't go into it more. It's the test of adult basic education, and so people that score lower on that test and don't have a GED, they don't have a high school diploma, that they can be at a higher risk for engaging in violence. And then gang affiliation, that those were the things that can increase risk for somebody being aggressive. Because so what the defense is trying to say is, I think the defense doesn't want the jury to give him the DP just because they're afraid that he might be a risk to society in the future. I think that's what the defense is trying to go at. I think that the defense is trying to say that just because he did these things in the past, he's going to get life in prison at the minimum. And the defense is pretty much just trying to save his life if they can. And once again, this will be up to the jury. The defense is doing what, and they're throwing everything at the wall. And the more thorough this part is, so if you have to skip this part, because we are talking about, they we'll get to it in a moment, but they're up here showing baby pictures of Tanner, and I'm like, but Athena is stuck forever at 7 years old. Like, how? So the defense was showing all of these pictures. I think they showed a picture of Tanner at 7, and they're trying to humanize him. And but a little bit of that made me mad. I do not know how the family is in the courtroom. The family is sitting here listening to all of this. And I don't even know Athena, and hearing them go through all of this information, trying to fight for Tanner's life, it frustrated me. But the more thorough this part is, the more likely whatever verdict the jury gives him, because with death penalty cases, they automatically get appeals. Automatically. They automatically get appeals. And so the more thorough his team does at the beginning, and so they're letting all of this evidence in. They're letting his mother talk about her history of trauma. They're letting the educational specialist talk about all of these things. Because if the jury hears all of this information, and they still, if the jury decided to go with the max penalty, then it's more likely that that max penalty will stick. Okay. All right. And so on cross-examination, the state tried to attack the credibility of the studies he was talking about. It was very, very academic testimony. I don't think it helped move the needle at all. I don't think it helped. But the defense gets to put this information in front of the jury. And just because somebody did a violent crime doesn't necessarily mean that they'll be violent in prison. That's what the expert said. And yeah. And so it was a lot. Now, for very, very emotional testimony, Tanner's birth mother came and she testified, and she was in physical pain. At the end of her testimony, she asked if she can be released, and I think she was going to go to the hospital. So she said that she had 2 neck surgeries, I believe, and she could feel one of the pins like falling out of place or something. And so she mentioned being in a lot of physical pain. Um, and She's born and raised in Fort Worth, Texas. I And so Tanner's mother dropped out of school when she was in the 9th grade. There were a lot of issues at home. She attended college in 2014 and had an essay published. It was Similes and Metaphors. Once she was sober, the article that she published was on the oppression of Muslim women. That was interesting. She described having a pretty difficult childhood, and that growing up, she didn't really dream of growing up or dream of a future. And that's really common with trauma survivors, that they have trouble thinking past their nose. They have trouble looking to the future. And that's a part of treatment. So if I'm working with somebody that really can't think past today, our goal will be, okay, can we think past tomorrow? Can we think to the next week? Like, we slowly start to try to expand, because when you're in survival mode, you're only trying to get through this moment. And there are some people that stay forever in survival mode. Um, and she talked about being left home alone, as young as 6 years old. She While her mother was at work, that she would be left alone at home. And um, when she was asked questions about her mother, she talked about that her mother tried her best, and she had a lot of difficulty talking about her past trauma, understandably. Because so I would be mad. Like if my kid did something, my adult child did something, and I'm up here on the stand having to talk about all of my trauma and all the stuff I did, like, but I think they're trying to make the jury feel bad for Tanner, like he came from this difficult past. I think that's what they're trying to do, but the state does a good job on redirect. Okay, so we'll take a breath. And I think the state does a good job on redirect. She talks about a history of SA that started by her stepfather when she was around 4 years old, and she told her mom, and her mom didn't believe her, and that harm continued on and off, until her mother left him. And she had a second stepfather that sounds like he was safe, and it doesn't sound like there wasn't anything from him that she talked about on the stand. She was sent to rehab when she was 14 years old, and she did report the essay while she was there. And in order for Tanner's mom to come home from rehab when she was 14 years old, she had to, um, mom had to kick Larry, and she apologizes. So she doesn't want to say people's names because she's all here for Tanner. Yeah. Yeah. So, but with her history of trauma beginning at 4 years old, people will often use substances to cope. Um, and so it's not an excuse. It just kind of helps me understand that at 14 years old, she went to rehab. She has had multiple stints in rehab and has struggled with sobriety throughout her life. She talked about using cannabis to self medicate, and she needed a way to escape her own head. She participated in counseling. She dropped out of school around 14 or 15 and worked jobs, including working at a topless bar when she was maybe 17 or 18 years old. And she said, when you're harmed, and so there's a word YouTube doesn't like, but when you're harmed at such a young age, you think, this is what I'm here for. And she talked about wishing that she hadn't done that type of work, but she really didn't think that she was worth, or and so these are my words. Based on her testimony, it seemed like she was saying she really didn't feel like she had anything other to offer than her body. And in order to get up on stage and stay on stage, because she was very anxious about performing in the topless bar, and so she would use alcohol at first, and then she started using, I was checking to see. Yep, okay, good. She started using alcohol at first, and then she started using meth, and then heroin. And then once people start heroin, that typically becomes their substance of choice. Once a person, their first time using, they'll never have that first time ever again. And she talked about feeling better when she was on opioids, and that the drugs got rid of the movie that played in her head every day. And she was describing PTSD symptoms, that the movie was her past trauma. and it would play over every day. But the substances made that go away. She had been diagnosed with bipolar disorder, schizoaffective disorder, and PTSD. And with the schizoaffective, that would have meant that she met criteria for some type of psychosis. She did not get into that, but she's not currently on any prescribed medication besides methadone. So she doesn't like being on medication. But as she was on the stand, it sounded like she was, like, as she was talking, I don't know, like, it seemed like she might be willing to attempt a medication. And for people that are bipolar, sometimes a mood stabilizer makes them feel like blah, like it can make them feel, because they don't get the high highs, they don't get the roller coaster, because the high highs can feel really good. And so, but there can be some irritability, there can be a lot that kind of happens with the roller coaster. And it seemed like there was still a lot of just me listening, it seemed like there was still a lot of PTSD symptoms and things. Um, um, she wasn't aware of the mental health diagnoses until her doctors told her about them. She went to doctors because she was feeling like harming herself and didn't feel like she could do anything right. She was prescribed medications, but she doesn't believe in medicine like that, and that's where, so especially for bipolar disorder, that is a chemical imbalance, and one of the best things for that diagnosis can be getting on a mood stabilizer. She talked about meeting Tanner's father, and they're in their first. Okay, so this is content warnings. Okay, content warnings for this. But in her first meeting with Tanner's father, she met him at the bar that she danced at. And on their first night, he essayed her and physically assaulted her on the very first night. And likely due to her past trauma, tr- harm might have felt like love. She didn't say that. That's me saying that. But there can be this cycle of abuse that kind of happens over and over again. She talked about marrying him and that she knew it wasn't love. They got married when she was 19 years old, and he was not physically aggressive with her until she decided to leave him. That was when the physical harm happened again. They would do substances together. Um, they would do meth only when they could afford it, but they made sure that they paid their rent, which is good. I mean, not good, but like, because some people get so into the substances that they don't pay their bills, and so it seems like they were at least paying their bills. Tanner's birth father is deceased, so he was he died. He was hit by a woman on a motorcycle 2 years 2 years ago while Tanner was incarcerated. Uh, so then the defense asked her about her life before getting pregnant with Tanner, and I think they were kind of asking if how many pregnancies she had had, if that was her first pregnancy, and she declined. She asked the judge, can I not answer some questions? She was very tearful when she was on the stand, and her face was blurred, so we did not see her face. Her face was blurred, and other people will say her name. Um, but yeah, okay. So that was that part. Um, so she did not, and the defense moved on. The defense, because they wanted to know if she had had prior pregnancies, and she did not want to go into that, and so they moved on. Um, Tanner has a younger brother that's 10 years younger, and he does not want his name mentioned at all, and I don't blame him. He probably declined. I don't know if the defense would have tried to interview him or tried to talk to him, but the younger brother does not want his name mentioned. He does not want anything to do with this situation, understandably. Um, She talked about currently having cirrhosis of the liver, and she did stop drinking when she found out she was pregnant. And so she found out she was pregnant when she was about 8 weeks pregnant. So they make it sound like she was heavily drinking throughout her pregnancy. So I don't know that he would have met criteria for fetal alcohol syndrome now, because they've done studies, and even somebody that's a heavy drinker, if they stop, like a lot of, because she was about 8 weeks pregnant, her stopping and not drinking anymore, I don't know that that would have had any, like, it wouldn't have been fetal alcohol syndrome. People only are diagnosed with that diagnosis typically when they drink throughout their pregnancy. And so, but the whole, I think the defense is trying to throw things at the wall. She did smoke during pregnancy. She smoked cigarettes, and she also smoked cannabis during pregnancy. And don't do that. So, cannabis can impact fetal development, and it can result in. I'm not a medical doctor. I googled it, so please do your own research. So that I'm not giving medical advice. Um, but she did smoke cannabis and cigarettes during her throughout her pregnancy. She talked about that the cannabis helped her with morning sickness, but so all do not do that. There are chew on some ginger. There are other things that don't impact the growing baby. And so, all right. So, all right. Younger brother that's 10 years old, 10 years younger. Uh, Tanner was born 3 weeks overdue, and he had an infection after birth and was in the hospital for 2 days. She mentioned that he looked like his dad, and she was happy to have her children. The defense, once again, is just trying to humanize him. She struggled to stay sober after Tanner was born, and she talked about that this was embarrassing. So when he was around 2 years old, she started using meth, marijuana, alcohol, and cocaine again. She talked about being unable to keep a job due to her bipolar disorder, and she admitted that he likely saw her substance use. She talked about him finding her passed out on the toilet one time and thinking that she was deceased. And so, yes, he had a very traumatic childhood. Yes. And at the same time, that does not excuse any of his behavior. Ah, so I did drink coffee during my pregnancy. I think early on. So I think it was towards my second and third trimester. I did all the things right. First trimester, but then I could barely stay awake. I had a lot of the second and third trimester were really difficult for me personally. Um all right. So let's see. She talked about being, she's been arrested for prostitution multiple times, and she helped start a program called Greenlight that helps women in difficult situations. And she was in and out of different inpatient programs at times. Tanner lived with his grandmother, and because like when she would be out of the facility, she would live with them at the maternal grandmother's house. And um there were times that she took him with her to the rehab facility. So there are some rehab facilities that hospitalize the family. So if there is a mother that has a child, they will it'll help the whole family system. And one of the people from one of those facilities did testify. Now, he could not remember meeting Tanner. He recognized the mother, but he didn't have any records to indicate what he had done. But he just in general said that the children received play therapy while they were in that placement. Welcome, watching from behind. Are we going to discuss the speech pathologist testimony? Yes. So we are going to get to the home-based speech pathologist. I'm going in order. Y'all know my brain likes to jump around a lot and trying to stay focused. All right. She talked about um that the grandmother, uh so Tanner's maternal grandmother spoiled him, and that's when they started putting up pictures of him as a baby, as a toddler. And once again, I started getting mad because Athena's parents are in the courtroom and they are never going to see their child past the age of 7. And so that's just how I felt about it. She talked about that Tanner was jealous of his younger brother, and she mentioned that opioids helped her pain, and she would leave the hospital against medical advice to use her substance of choice. I mentioned that one earlier. She talked about that Tanner struggled to interact with his peers. Multiple people are going to bring up that he was bullied in school. He was diagnosed with Asperger's syndrome and ADHD, but she didn't think that he had ADHD. The medicine would always change him and make him into something that he wasn't. He received SSI. So when children have developmental, so there are times that families will apply for benefits if a child does have significant needs. She talked about him having meltdowns and that he would hit the wall, break things, hit himself in the head, especially when he was being bullied in school. He didn't want his mom to go up to the school because he thought she would make things worse. She didn't want to use the grandfather's real name. And that was the step grandfather, her second stepfather. Um, and so Tanner lived with her mother and the second stepfather for the majority of his life when she left Terry, which was Tanner's father. She was scared. She was scared when she left Terry, and Tanner would see conflict between her mother and her step grandfather. And so she just said that she wears her shame like a badge, and um, she has one grandchild that's almost 4 years old, and that's Tanner's son. And she talked about that Tanner was very excited to be a dad. Um, he had, and then they talk about, they showed a video of Tanner with his son's first steps. And once again, I think they're just trying to remind the jury that Tanner is a father. And for me, it didn't help. It didn't, but the defense is trying to humanize him. They are trying. And so it was very painful to watch. And so that's why I'm telling this to you all. If you decide to skip it, you can. This was very difficult testimony to sit through. And the mom said that Tanner was treated badly by his son's mother. I don't know. And so the defense, sorry, no, wait a minute. And the defense asked her about Tanner pleading guilty to the charges, and she became very emotional. And she said that she was very mad at him and she wants to tear his ass up. So with the defense, his mother said she wants and YouTube blocked my comment. They wouldn't let me say it. I was going to try to say it again. That she wanted to tear his up, her son. And she talked about that she still loves him. And she said, I don't know who that was. That's what she said. So then the state gets up and reminded her that she did a deposition with them where she talked about her difficult childhood, that Tanner would live with his grandmother and step grandfather when the mom was using substances. she called the step grandfather Pawpaw, and she said that Pawpaw was good to him. And I think he's also a Vietnam War veteran, so he likely has. So any any Vietnam War vet has PTSD. Like the conditions, what they saw, what they experienced, that they're going to have some PTSD. They did not get to that. They did not get into that on the stand. My understanding of military service members, history, all of that, that's my assumption. She did not want her other son to be discussed during this case. She talked about that Tanner graduated from high school. He played musical instruments. He was really good at picking up musical instruments, and that he initially told his mother, or she initially believed the story that he backed into Athena, panicked, and that was what happened. Now she believes something different. And so the state asked her if she had been watching the live streams, and she said, "Please don't put me in jail." So I don't think the witnesses were sequestered. I don't know if the witnesses were told not to watch the stream, but I guess she had seen the testimony. She had been watching the trial, and that's, she's the defense witness. And so if she watched it, like I don't think the state would object, or I don't think they would press charges for her having watched it. The defense would have been upset if a state witness that wasn't supposed to watch it, if they had watched it. I think the defense would have made a big deal about that. And because we're in the penalty phase, and really her having seen it made her reaction more real. She became very emotional when talking about now understanding what truly happened to Athena. And she said, "I don't know what to say. I'm very sorry." When she was asked about her understanding now of what happened. And then she asked if she could go to the hospital, and Tanner had no reaction to her. His mother is on the stand, falling apart, absolutely bawling, falling apart. And he's just sitting there looking. There is absolutely no emotion. Could a part of that be autism spectrum disorder? Yes. Could a part of that be psychopathy as well? Yes. I didn't assess him. I don't know. But the jury is probably watching. He didn't seem to care. He's very blank, and there was no empathy in a way. So there are some people on the autism spectrum that do show empathy, that if their mother was crying, they might not understand why, they might not, but they would kind of they might look uncomfortable, or they might look away, but he was just sitting there looking at her. When they would pan over to him, there was no emotion from him at all. He was very stoic. The defense has not rested yet, to my knowledge. Y'all correct me in the chat if I'm wrong. I think they might have more witnesses. I think they said, if I'm remembering this case right, I think they might have said they have 19 witnesses. They might have said that they have 19, and it's been 3 days. So the defense has put on multiple witnesses. So yes. Thank you for being a member for 1 month. I can't watch this trial. Thanks for sharing your thoughts with us. Yes. So I am watching it, so y'all don't have to. Okay. They have not rested. Yes. They still have 7 more witnesses. So depending on how long that testimony goes, because I do think they are going to have somebody that assessed Tanner. So the next time I cover this case will likely be next Saturday. I'm not going to cover it, so that I'm going to keep the Tuesday case hopefully lighter. We'll see. So I'm going to try to talk about something different on Tuesday, and we will come back because we might have a penalty by next Friday. We might. Because I do think the state is going to have rebuttal witnesses, and then it's going to go to the jury. So I'm almost positive that the state is definitely going to have rebuttal witnesses. This has been, more history is coming in with this case than I haven't watched that many penalty phases. I did watch Wade Wilson's penalty phase, and they also tried to introduce brain scans and their expert came across kind of like a snake salesman. Like, I don't know, like he came across, I don't know, like it wasn't. But then the state's expert pretty much refuted everything that Wade Wilson's expert said, and so and he did get the highest possible penalty for his case, and he's continued to have issues in jail, and so that's that. All right. So if you are watching it, so I sometimes watch it with Grizzly True Crime. I love her snarkiness. She does pause it at times, and when it's starting to get tough. So I've been watching it there. Unless I was just trying to hear the witnesses without any commentary, then I just watched it with the closed chat on 2 times speed. All right. So his paternal great aunt testified that Terry, so Tanner's father, was homeless and unstable. He was on drugs. He was in and out of prison several times. Terry has a whole bunch of kids, and it was a joke about how many kids Terry had. Tanner is one of the children that Terry had. So, but talking about Terry in this way kind of could lead you to the conclusion that there might have been some antisocial behavior that could run in the family. Like Terry, Tanner's dad, was in and out of prison. Tanner's mom, in and out of prison. Neither one of them, to my knowledge, has autism. And now neither one of them unalived anyone either, according to my knowledge. And so that's where, when we talk about nature versus nurture, there can be a play of a little bit of both. So to me, talking about Terry's, and he stole, he he was aggressive, he did all those things. I mean, I didn't see how that helped, but it wasn't my role. So then day 10, so all of this was from day 9. If you want to go back and watch anything. So court resumed on Wednesday of this week. So that was all from day, I think might have been day 8 and 9. I probably combined some things. But then day 10. So yes, because day 10, so that was day, so all of that was from day 8 and 9. And then Friday was day 10. Um, they had, I'm holding my head like this because I'm trying to figure out who it was. They had somebody testify. So it was another family member that testified that Tanner's father left the home when he was 13 years old, and he spent 90% of his adult life in prison. And this female, I want to say it was like a great aunt, or I don't know, it was some other family member, also described that Terry, Tanner's father, threatened to kill her and was not a nice person, and that Tanner's father had a long history of substance issues, physical aggression, stealing. And then they talked about that Tanner cried a lot as a child. And the state, on cross examination, pointed out with the witness that was testifying, she also had a very traumatic childhood, and asked her if she ever did any crimes or murdered anybody. And she was like, no. So her childhood was just as bad as Tanner's, and she didn't do anything. She didn't harm anybody. So then a second cousin, I think it might have been like his father's sister's cousin. I don't know. Like, so a second cousin testified that she babysat Tanner when she was 10 and 11 years old during the summer, and he was an infant. She would go for the weekend and she would stay. So probably so Tanner's mom could work all night doing the adult entertainment and any adult activities. She was likely doing that all night. And so it was from when he was an infant and maybe when he was about 2 years old. And she testified that she would be left for the weekend, and she would have food, she would have phone numbers, she would have money to, go and buy something. The neighborhood wasn't the best neighborhood, but and so she was just cautioned to be aware of her surroundings. And at the time, she thought her cousin just really trusted her, that Tanner's mom really trusted her, but now looking back, she realizes that she never should have been left with an infant at 10 years old for the amount of time that she was babysitting him all by herself. And then when she was 11 years old, Tanner's mom paid her with drugs. All right. So Tanner's mom paid her with drugs. And so I don't question. So I do believe he likely does have autism spectrum. I think there's more than just autism. So Tanner was diagnosed with autism spectrum and he has an IEP. I think his issues go beyond autism spectrum. Those are just my general thoughts. Okay. So she was offered, would you like drugs or cash? She picked cannabis and she was drugged. And that's how she was paid for her second summer. And she talked about that Tanner would eat coins and because he would poop them out and she would find them in the toilet. And so they would have to keep coins up high. And he would throw aggressive fits. And looking back now, she realizes that his speech was likely delayed. Okay. An expert talked about lead exposure and that Tanner had 24 times the amount of lead exposure in his bones. So they did like they had this special technology that they used to research lead in people, and no level of lead in a person is good, but they say over, I think, 0.5 or over, so he said over 3.5, they recommend some type of treatment. Tanner was never treated for lead exposure, but this expert talked about in order for it to show up in the bloodstream, if it's ingested, it wouldn't be detected in the blood after 30 days unless there was continual lead exposure. And so the defense is trying to throw everything at the wall. Okay. I know our kid's pediatrician screens for lead exposure and but he really didn't get into the impact on behavior. And so lead exposure can lead to increased impulsivity, aggression, hyperactivity, inattentiveness, and social withdrawal. And it can impact learning disabilities, juvenile delinquency, and mental health problems. So those are some of the impacts of lead exposure, especially in really young children. Okay. So that was that expert. So we don't know how he was exposed to lead because they are testing it now. So this guy tested Tanner last year, at the end of last year, and it wasn't something that was ever detected in his medical records. It was never something that was tested or treated prior to this crime. So we don't know. And so I'm glad it's okay now. We did update the router and everything. I'm gonna have to call Verizon back again because we're still not getting the speeds that we should be getting. I did do everything on my end, but please know I'm gonna try to work on this. But yeah, things have been freezing on and off. I at least don't have 1,000,001 windows open. So normally I would have 1,000,001 windows open. I do not have that today. All right. So thank y'all for sticking with me. Good. All right. So let's see. Then there was mental health expert. That was the counselor at the treatment program that just talked about a dual diagnosis. So dual diagnosis of substance and mental health that Tanner's mother likely would have had a substance. So she had a polysubstance abuse disorder. So, because she was using multiple substances, it wasn't just one, it was alcohol, it was all those other substances that I listed before. And she also had PTSD, bipolar disorder, and possibly schizoaffective disorder based on her testimony. And so, they worked with, and that Tanner was there when he was about 6 years old. Those records do not still exist. And he did not have any specific memories about the client or the family. So that was that testimony. So an IEP specialist, she talked about that every person with autism is different. And he was in a behavior improvement class for the beginning of the day. And this was when he was in elementary school. And that he also received in home therapy with a speech language pathologist. We are going to talk about her testimony in just a minute. They also talked about that there was a triennial evaluation every 3 years. And this was a special education evaluator that did one of his evaluations. So she did classroom observation, and which included sometimes observing in the lunchroom or during more social periods. And he was diagnosed with a mild form of Asperger's, which would now be autism level 1. Excuse me. In the DSM-5, they got rid of the Asperger's diagnosis and they instead have autism spectrum disorder. And so it goes level 1, 2, or 3. Level 3 would be speaking, very high levels of support, maybe needing significant assistance with hygiene, feeding. Level 2 is needing high levels of support, but not quite. So less than level 1, more than level 1, less than level 2. And then you have level 1. All right. I'm glad that they got rid of high functioning, because you used to talk about people being high functioning, or Asperger's used to be thought of like high functioning autism. And so instead they have levels, level 1, 2, or 3. And just because someone is level 1, the level doesn't necessarily, like, it gives you a general idea of how much support the person needs, but that really can vary based on the individual. And so they talked about that he had a lack of empathy, difficulty getting along with his peers, poor eye contact, poor hygiene, rigid about change, and sensory issues. And he did well in school and was well managed. He did have difficulty getting along with some students, and at times would prefer to interact with adults. And he could be argumentative with adults at times. And they had recommended him for a psychological evaluation and for medication management. They were concerned about his emotions. His difficulty with emotions went beyond. And she didn't say this, I'm saying this, that his difficulty with emotions likely went beyond an autism diagnosis, or they were hoping that he could get more support around that than he was getting with his current services. The state asked if interventions improved, and with those interventions, he did have improvement. And the person on the stand clarified that lack of empathy doesn't always exist in people with autism, and there are other things that to consider with a lack of empathy. And he was not assessed for oppositional defiant disorder, or just to see if the issues were more like willful or was it behavioral. And that can be difficult to parse out in general anyway, but yeah. Um, his fifth grade teacher testified and she became very emotional. So he was only in her class for a few months. And you could just you could just tell that she really loves her job. She loves being a teacher. It was probably hard for her to realize that a student that was in her class is on trial for this type of crime. She talked about that he struggled moving in the middle of his fifth grade year. The other students thought he was odd, and she became emotional when discussing enjoying being his teacher. But it seems like she enjoys all of her students. She did not observe any anger issues, but did move in the middle of the year. And the new school called to see how they were managing classroom management. So he only attended that school for a few months. Now, okay, now I don't know why we had they had a proffer outside the presence of the jury of the speech language pathologist. So maybe the state hadn't met with this witness yet, or something happened, because the defense and state did a proffer outside the presence of the jury. This person, so they said they didn't enjoy being on the stand, but it was interesting to watch. It was interesting to watch. And I'm saying that because the state was trying to limit her. And I think so. This individual was a fact witness. They weren't going to be giving opinions about anything. Yes. And so, yeah. And so with them being a fact witness, the state asked, will you be giving opinions on the IEP? So the state was asking, they're like, yeah, I can do that. And the state, that's where everybody was like, no, we're going to limit your testimony to what's in the record, what we already have. Please don't refer to anything that's not already in evidence. It almost seems like this person came forward late. Like she was, it was, it was entertaining. So if you do want to go back, it was very interesting testimony. I don't think it was helpful because at the end, it took a turn for the worse. And we will get there. Give me a minute. No spoilers in the chat, okay? We will get to the like what moment in a moment. So this individual was a speech language pathologist that worked as an in-home facilitator with Tanner from 2003 to 2004 when he was in junior high, when he was in about the 7th grade. They asked about how old Tanner would have been, and she said, I don't know how old I am. She was a hoot. She was a hoot. She described him as a great student. And to me, it seemed like this person wanted to testify and help his case, but I don't, because we're going to get to some information later and I don't know how helpful. Her credibility with me was struck once she said something a little bit later for me personally. But so then when they were in jury, she talked about working with families and the impact of family things on the school. And most people talk about kids being in school more than they are at home, but she talked about like the home environment really having an impact on school. And so when kiddos are having behavior issues at school, they like to go into the home and make sure what's the discipline, what are the strategies? Let's implement some things to address behaviors here. Because if things are really permissive in the home, the child is going to struggle with structure in school. And that's my wording. That wasn't exactly how this individual said it. She asked, can I speak freely? No, you can only answer the questions you're asked. It seemed like she wanted to give a narrative. So because she was asked a question and I think she wanted to give more details, and the answer was no. No, you can't give a narrative. And so I found that it was long watching all of this testimony. Okay. I did it in a day and a half and it was a lot. Okay. So he struggled with social skills, struggled to understand jokes, and that he was bullied. She became emotional when talking about him being bullied. Um, she said that he could identify other people's emotions, but he struggled to understand that he couldn't take other people's things or the impact his behavior might have on other kids. She described him as a very concrete thinker, and the way that she described it as taking things too literal, but also the way I sometimes think of it is that a person is really rigid, so concrete, they can get stuck easily. He struggled to understand jokes, um, and but he was not aggressive towards others. He would get upset when people didn't follow the rules, struggled with change, and had to learn coping skills. She said that Tanner's mother was not a mother. She had problems of her own, and Tanner was on the back burner. That was, but I guess I don't. That was Okay. Uh, and this individual thought that the mother being in the home messed up the routine. And the family had moved several times. And just because people move doesn't necessarily mean that it's gonna be hard on a child or even that it's gonna be hard on an individual. It was very harsh. Her statements about the family, that was very harsh. That was very harsh. So, I don't think she was I think she looked at records. So I think there were records. I think there were records. And, because the defense would have, uh I think she said some things that the defense wouldn't have wanted her to say. Some of her testimony, I don't think it helped. Like, he was making progress. He knew right from wrong. So a lot of those things that she was saying, I don't think that's the narrative that the defense would have wanted. I think the defense would have wanted this narrative of he's always struggled, he's always had these problems, like this has been a long-standing issue, but it sounds like he was doing okay. And he wasn't a major problem in school, and it seemed like outside the social thing, it seemed like things were going okay. She also mentioned that of the places they would visit in the community, one of them was her home, and that was 2003. You st so but I think it was outside her home. I don't think it was inside her home. We are discussing the speech language pathologist from Friday. Ooh. What? I didn't hear that the brother also had a history of harm. Wow. With the mother's occupation, I would have had, so I'm going on a tangent. With the mother's occupation, she was an adult. She did adult things. I would have been concerned if he was ever exposed to adult intimate activities early on. I've worked with individuals that were raised by people in similar professions, but they were eventually removed from the home, ended up in foster care, adoption, or in a family placement. And some of them had memories of their parent engaging in activity, or they had their own history because the people allowed into the home would sometimes harm the child. I also worked with individuals that we believe strongly. We weren't able to get the testimony, but there were a lot of red flags for possible trafficking by the former, because child was removed from the home. But we had big concerns about things like that. Um and so I used to be an in-home therapist, and I would take kids to restaurants. We would go to, because they would earn rewards, and so sometimes it would be McDonald's or it would be Chick-fil-A. I used to do supervised visitation, and so we would go to the park. I would take kids different places, and before we would go out, because I was their in-home therapist as a psychology mental health therapist. She was speech language pathologist. Sometimes they have ABA, applied behavioral analysis, but I never brought people to my home. Never, never. That would have been a big no-no. And when I was in their home, I was just very respectful of boundaries. If I ever ate with the family, I brought pizza, so I would bring something for everybody to eat. But if I was there during dinner time, I would tell them that I just ate, or like I would bring my own food. But that is common to take people out into the community. My thing was she said that but it is what it is. So, all right. Getting back to the speech language pathologist testimony, she talked about seeing an improvement in his behavior, and she also clarified that she's not saying the autism is an excuse, a defense, or that it justifies. But then she said he shouldn't have been driving that truck all by himself. I have questions. So then the state gets up for cross examination, And they point out the fact he had the capacity to change his behavior. His grandparents were a stable presence. If anything were a problem, so if there was any harm, so if anything was unsafe, because she was a mandated reporter, she would have had to report that. And she taught him appropriate behaviors in the community, and he had the capacity to make the right decisions. And he learned these things, and he was able to apply them. There was a tense relationship with his mom. He had manners. He said, "Yes, ma'am," "No, sir." Uh, and this was from over 20 years ago. And she was asked, "So what's your understanding of what happened in this case?" And she said, "I saw it on the news a while back. He was backing up his truck and he hit the the girl, and then he overreacted." No. So the state didn't even clear, because she's lost credibility. So she's up here saying he shouldn't have been alone in the truck when, like, the narrative wasn't he accidentally bumped into somebody. This was predatory behavior, in my opinion. In my opinion, for he was not safe with that, because there were teen girls that have made allegations, and we now have a deceased 7-year-old. In my opinion, he was a predator, and I don't think his autism diagnosis, like, this went beyond that, because he was skillful enough to nobody was around. Do you know? And I think he knew this was wrong. I think he knew. Exactly. Like, that's how it felt to me. And even when so I did watch the video of him interacting with the family the day before. So I think in his mind, I think the plan, and I don't know this for sure, but the plan could have started that prior day when the dad came out and helped him carry and the big package in, and he almost drove off with the back of his truck up. I think that's when he saw her, and yeah. So, and I think there might be testimony about antisocial personality disorder by the state. I would be interested to see where he falls on that particular spectrum. I would be interested to see that, because and in my prior video talking about autism versus psychopathy, because psychopathy is not a part of the autism spectrum. That is something totally different. A person can have autism spectrum disorder and features of antisocial personality disorder. I have not assessed him, so I can't say what he does or does not have, but a person can have both. And I think they gave the jurors days off. So they saw that horrific video that I will not watch. I don't want to see screenshots. I don't want to hear reporting on it. I have not heard, thankfully. I've protected my brain from anything about what the jurors saw on Thursday of last week. And then they had Friday off all the way and they started back in court on Wednesday. And I think they gave them that break. And I think the defense wanted them to have that break, because if there hadn't been that break, those jurors probably been like, let's sign him up now. Like they probably would have been so mad. They probably wouldn't have heard anything else. That video is an appellate attorney might have said that video was so prejudicial to the client that, like, there needed to be some type of cool down period. And I think that's why they had multiple days off of court after that video. All right. And once again, we want a strong defense, because whatever the jury decides, we want the verdict to stand. Okay. So I'm about to get to the neurologist. Oh, so, okay. So that might've been the first one to the guy. So that was, so did you, so so there was a I know he was a clinical psychologist, forensic psychologist. He did a lot of work on personality disorders. And I think he just doesn't like that research being used to determine whether or not somebody should get the death penalty or not. For this case, the state could just say this is eligible. He pled guilty to capital murder, and one of the things that they can consider is this. I don't know, because he's either going to get the death penalty or life in prison. He's never going to get out. He's never going to be eligible for parole. Nobody would ever let him out. Hopefully, never ever. And so he's going. So those are the only two options. And the defense right now is just fighting for his life. That's what they're fighting for. Thank you for mentioning that they did Daubert hearings during the days off. I did not see that. So thank you for adding that. All right. Ooh. All right. And so please take care of your mental health. If you do decide to watch any aspects of it, please take breaks. And then please understand that sometimes if it gets stuck, like you might just have to talk to somebody. Like there is such thing as secondary trauma. And so please take care of yourself as you're watching true crime. All right. And so yeah, she just thought that he needed intervention. This is speech language pathologist. So then the neuroscientist, he gave a PowerPoint presentation. It felt like a lecture. So I was exhausted. Oh my gosh. So the last two, I don't know. So, but a neuroscientist, he specializes in autism, TBI, and PTSD. He starts talking about the neurons, the dendrites, the axons, networks of the brain, theory of the mind, understanding what somebody else is thinking. And it's also thinking about your own thinking as well. And then he talked about factors that impact the brain, fetal alcohol syndrome, autism, fetal alcohol exposure, and the exposure was before 8 weeks, but okay. Autism, ADHD, toxic environment. And he also hypothesized that Tanner might have had head trauma, but they don't know for sure. It felt like the expert was giving a class presentation. He showed MRI scans of the brain, and the radiologist noted that there are no gross structural abnormalities, and the MRI cannot be used. So there is no brain scan that diagnoses autism. So sometimes we know certain parts of the brain, we know some things happen with individuals with a diagnosis that have confirmed diagnoses of autism. But just because somebody has a brain that looks that way does not necessarily mean that they have autism. And so he talked about different areas of the brain and how things were lit up and what things were communicating. I started getting sleepy. I started getting so tired. We're talking about theta baselines, significant abnormalities, beta. I literally wrote blah, blah, blah. Empathy, that he struggled, like, so the area of his brain so it looked like, so the brain where you look for empathy, you don't see that with him there. And you put everything together and he found some brain abnormalities. So on cross-examination, the state state wanted to reiterate that there are no gross abnormalities with his brain and that none of this can be used to diagnose him. And then we talked about brain versus the mind. And this guy was very emphatic that, if the brain is damaged, it's going to impact the mind. And the state wanted to talk about free will versus choice versus not being able to control anything. And that these scans, all it might say is somebody might have more difficulty controlling some things, but none of these scans can really, So it was a lot of information. I listened to it all. It was exhausting. That's what I had. Did y'all have questions about any of it? Color coded a lot. I really felt like I was so I did take neuropsychology. That was one of the classes that we had to take. Because a neuropsychologist are clinical psychologists that do additional training and fellowships to be able to specialize in neuropsychology. And so all psychologists study some neuropsychology, but neuropsychologists go deeper into specializing in neuropsychology. And so, okay, the Daubert hearing was to evaluate the admissibility of expert witness testimony. Thank you for adding that. It was a lot of testimony. Oh yeah. Ooh, 40 I missed that part. I must have tuned out when they said he was paid $40,000. Nice. He's a PhD. Wow. And I think the medical doctors said that there was no observed difficult. I don't know. So I think the state is going to have their expert that's going to come in and talk about all these things. Um, I don't know. I think the testimony from the family might impact the jury more than some of the blah blah blah. Look at this scan. He seems so pleased to like have his PowerPoint and be up there. he he did a better job than Wade Wilson's. So Wade Wilson's, I don't I my just personal thoughts, my personal thoughts. This guy seemed more credible. It did, and it just was, I don't know. It felt different to me. He showed all his data. They paid for all the scans. It was multiple scans, and I don't know that the jury is going to care. I have never heard of Alpha Stem. I haven't heard of it. $40,000 because the next guy was paid. I want to say he was paid 7,000. The guy that appeared on Zoom was going to be paid like 7,000 or something. And he specialized in psychology. He's in neuroscience. He's a neuropsychologist. He did not evaluate or assess him. He talked about the brain. He talked about that autism didn't cause this crime. I was so tired. I did listen to all of his testimony. I didn't get anything from it. So, um, the jury might think back to the one expert that said we're really bad at predicting whether people are going to be violent or not in prison. And on death row, you have less interactions with other inmates. You normally get your own room. And then and so they normally don't engage with the general population. There are a lot of things that happen with like that. It's different. So individuals on death row, they're going to have less infractions because they're not around other people as much. And so, okay. So yeah. So the last guy was maybe paid 4,000, but then I thought his testimony that day was an additional like 1,000, I think. So it might have been 5,000 total. Yes. Total of 5K. Thank you. All right. They also talked a little bit about neurofeedback, that you can use EEG to do to see how different things are functioning. There are psychologists and counselors that use neurofeedback to do brain training, and that was that part. So, the video would be the state's final evidence, that video. And then all the lies he told, how he was concerned about getting to his son for Christmas. He tried to blame it on this fake person. He wrote that apology to the family where he tried to blame FedEx but then wrote to the police that it was somebody else. And so I think the state is going. I think the jury, I don't know for sure, but I would be surprised if he got life in prison. I would be surprised. I respect the jury's decision, but I would be surprised if they said life in prison, especially in Texas. All right. Let me know if y'all have any final questions. I so appreciate you all being here. If you all follow Kathy from Gossip, Rumor, and Innuendo, let me see if her channel is back up. She ended up getting hacked her YouTube channel was. And so she had to start a new channel. If you go to my, it doesn't look like, so she has Real Curtain Twitcher is her new channel. Let me share my screen. And she's been posting updates on what's happening with that situation. So if you follow Kathy, and I have a link to, and so it looks like things are progressing, but this is her channel where you can find her for now. I hope that there are no issues with the videos. I hope the people did not touch the videos on the channel. I hope that everything is able to be restored. If you are a streamer, please be wary. If you get a link and if you have to immediately enter your password or anything like that, sometimes those are spoofed links that are meant to be a hack to steal your information. And so I do hope that she's able to get her channel back as soon as possible. Yes, I'll post it in the chat because I just had it right there. Here. So we can get her some views and all right. So there we go. There is her new channel. Please take care of yourself. Take care of your mental health. Take things one day at a time. And I am so glad to get to share this with you all. We will see what we cover on Tuesday. We might talk about therapists on social media. So there was some social media drama over on Threads. And so like we might talk about therapists and social media. We'll see. And we will go there. Be kind, don't do crimes, and I will see you all next time. Have a good one. Bye.